Welcome, Dr. Koob. It is a pleasure to have you here today to discuss an incredibly important and evolving topic, alcohol consumption and its impacts on health. As clinicians, we've seen a shift in recommendations and also cultural perceptions over the past several decades. And part of the shift is coming as we learn more about the different thresholds of risk for different harms from alcohol. Before we dig in, I'd love to start with the basics. What are the latest updates in safe alcohol consumption guidelines?
We adhere to and support the dietary guidelines, and that is 2 drinks a day for males and 1 drink a day for females, and 14 a week and 7 for a week for females. These are guidelines, and you have to kind of use common sense. You're not supposed to do all 14 drinks on a Friday night.
That's a very good point. And, I will note that we just had 2 days ago the panel recommendations released for the upcoming guidelines for 2025 to 2030, and there was no shift in those recommendations in that panel report. So how has emerging evidence shifted the way that we should be counseling our patients around the harms of alcohol, given that these are sort of basic recommendations, but we have to take an individualized approach with our patients?
Well, there are actually some people who probably shouldn't drink at all. So that's one caveat right there. If you're pregnant, thinking about getting pregnant, not a good idea. If you already have an underlying condition that alcohol exacerbates, you need to think about that. Anything ranging from acute respiratory distress syndrome to pancreatitis to alcohol to liver disease or any aspect of that. So, and then other individuals, may metabolize alcohol differently. They don't feel good when they're drinking. So that's one piece. The other piece is if you are drinking past the dietary guidelines, the risk of harm increases with the number of drinks. And we know even at average of 1 drink a day increases the probability of breast cancer in females by a small percentage. If you're not feeling well when you're drinking, then, that's something, another metric and something you may want to discuss with your physician. If you're feeling better when you're not drinking, then your body's trying to tell you something. So listen to your body.
So I'm a primary care physician, and what I often hear from patients is the idea that red wine is part of a healthy diet. So they want to consider the intake of red wine in particular to prevent disease. How should we counsel our patients when they come to us with those types of questions?
Well, it's a myth that red wine per se is conveying the health effects. It's probably more the diet that individuals are partaking of. It may be socioeconomic because higher income groups tend to drink red wine more than lower income groups. There's really no evidence that the amount of antioxidants in red wine is going to convey any major beneficial effect. And, wine is alcohol, contrary to popular belief in some quarters. And the more alcohol you drink, the more the risks are of problems associated with alcohol. Some of the studies, original studies that were done claiming that there were beneficial effects of drinking, basically were using, the abstinent group as the control, the abstainers. And unfortunately, that's often individuals who are already ill, and that's why they're abstaining. When you actually use low alcohol intake within the dietary guidelines recommendations, then all these differences fall apart, and we have a kind of a dose-dependent increase, even in cardiovascular problems, with arrhythmias, hypertension. I met with a Mayo Clinic doctor when I was visiting the Mayo Clinic and giving a talk there not too long ago, and he considers screening for alcohol misuse a key part of his treatment of hypertension now. And he was a cardiovascular doctor.
That's really important information. Do you have any sort of insights or information beyond what you told us about really just sort of personalizing alcohol counseling based on the risk for the patient in front of us, based on their personal health risks or risky behavior?
We now know that there are 200 different diseases and conditions that are exacerbated by alcohol. And I've already listed some of them. But what many Americans probably don't know that is that 4 to 6% of cancer now is attributed to alcohol. And alcohol is the third preventable cause of cancer in the United States, the leading one being tobacco, of course, and then the second one being overweight. People need to realize that alcohol affects everywhere in your body, more or less. Acute respiratory distress syndrome, pancreatitis, gastrointestinal bleeds, the cardiovascular effects I mentioned, arrhythmias and hypertension, and not to mention falling off ladders. A third of accidents in the summertime associated with water sports involve alcohol. 2 years ago, what we call the healthcare professional core resource on alcohol. And in that, there are 14 units that should be useful to any primary care doctor, but anyone in the health profession. And you can get CME credits for going through them, but there is a whole section on screening, brief intervention, and referral to treatment, which is should be a key part of any physician's, intake, to be honest, because alcohol misuse is a window on a lot of other medical conditions.
That's a key point, and I think really critical in addition to our other general screens that we're doing to really think about alcohol use disorder screening. So for patients that do have an alcohol use disorder, there's a debate or a question about whether non-alcoholic products are a good alternative. Should clinicians recommend non-alcoholic products?
By and large, the answer would be yes, that it's a great alternative. What I read on an article, they're fairly tasty these days, the new beers that are non-alcohol containing. The only downside is that if you are in recovery, the cues that are associated with a non-alcohol beverage can elicit craving. And so you have to be aware of that. So you may want to approach with a little bit of caution if you're in long-term recovery. Some individuals can partake of these non-alcohol containing beverages without then suddenly wanting to shift over and go over to the other side.
And to follow up on your earlier point about really sort of thinking about the screen and how often we incorporate it, particularly as we're managing other chronic conditions, how can clinicians look to identify if a patient is not completely forthright? How can we approach these conversations so that we're not judgmental and yet still effective in our screen?
We want to avoid perpetuating the social stigma that individuals don't tell the truth. Most people probably do tell the truth as best they can. There are screens like the Audit C, which is 3 questions, and it can be done in 3 minutes, and people probably respond pretty accurately.
Are there any other final points that I didn't ask you about that you'd like to make sure that come across in this conversation?
We are the National Institute on Alcohol Abuse and Alcoholism. The acronym is NIAAA, NIAAA. If you type that into any search engine, you'll come to all the resources we have. We have Rethinking Drinking for people to understand what you and I have been talking about, what is standard drink and what are the guidelines. We have a navigator that'll help you, treatment navigator that'll help you find treatment. Even you could type in your zip code and find a treatment provider in your area. Physicians can use that. Clients can use that, patients. And then I mentioned to you already the healthcare professional core resource, which really tells you everything you want to know as a healthcare provider about alcohol.
Thank you so much for joining us today, Dr. Koob. Very much appreciate your insights, and thank you for keeping us up to date.